All right, good afternoon, everyone, and thank you once again for joining another Google Plus Hangout by Channels Beam, Channels Television. Again, your usual host, I am Victor Matthias, and today we're looking at the Ebola virus disease, and our focus is how the federal government has been able to stop the spread, and we'll also look at ways in which we can use to stop the spread of this virus. I have with me Henry. Henry is in Stockholm in Sweden. Henry, thanks. Good afternoon, first of all, and thank you for joining the Hangout.
Yeah, thank you as much. Thank you very much.
Sure. Any is in Lagos, Nigeria. Patrick, thank you for joining this Hangout this afternoon. All right, Patrick. So let me just start now. There's this saga going on between the federal government and parents. In fact, even the Nigerian Medical Association have also kicked against the decision by the federal government to bring back the resumption date of students in public and private schools to September 22nd. Right now, the debate is still ongoing, but I think the federal government is adamant that that date stands. Henry, let me start with you. What do you see? What's your take on that? Do you think it's a good one for schools to resume or not to resume? What's your take on that?
Actually, I'm of the opinion that the students should return back to school, because if we keep looking on delaying this thing, then we have to stay for the rest of the whole term. I don't know presently what section they should be in school right now, but I think if the necessary prevention measures are taken, then it's okay for them to go back to school. If they're educated on how to the sanitizing, eating, and everything is well, then they should go back to school. Because if you keep saying, we keep hearing news about 20 people, the Ebola is just one victim, all of a sudden it comes down to 20 from the Minister of Health. Because I keep reading about these things anyway. So it's like we're not even specific. We're not so sure about how many people have this thing. So for me, I think the students shouldn't be delayed because of something that there are preventive measures towards it. So it's like they should be taught on what to do, take the necessary precautions, and let the students go and learn. It's very important for them. So I think that's my own opinion anyway.
All right. Patrick, what's your thought on this?
Well, my thought on it is that I feel like they should also return to school if proper precautions have been taken. Now, I have heard about a device that is in the country right now that is used to sanitize the air. It's some kind of a halo fogger, and it sanitizes the environment. So it will be Ebola or any other disease or pathogen cannot be transferred once the room has been sterilized. And they have that product in Nigeria now, so I don't understand why it's not being adapted to every classroom or every school to sterilize before the student resume. So I think if they can take that measure, then I think that the students can go back to school. But if not, you have to worry about the transmission and spreading of this disease, because it is a deadly disease. And if proper precautions are not taken, then I wouldn't send my kids to school if I don't know that the proper precautions have been taken.
All right, Patrick, just talking about these things, and you said there's this device also, but how do people get to know about it? Because it seems I haven't even heard about it. I'm just hearing about it for the first time.
There's a website, olivemedicalsupply.com. So if you go to that website, it tells you about the device.
So, all right, Patrick would see to that. Hopefully, people will check that website. It's Olive Medical School. Did you say?
olivemedicalsupply.com.
Okay.
All right. MEDICAL supplies SUPPLY.
All right, great. So Henry, let me just come back to you. If
Yeah.
Patrick is saying there's this device, how advisable do you think this is? Looking at the fact that people even have the fear for the unknown.
Well, if such a device is existing, then I think we should take advantage of it anyway and try and see what we can make out of it. But if the sanitizers, the local sanitizers, and basic wash your hands, which the Federal Ministry of Health recommends, is something that can prevent it, And basically, we know the symptoms of this thing, the fever and every other thing that is being mentioned. I think those are key and basic things we should look into. And if those things are well looked into, then I think we can, to some extent, prevent it from spreading out or being spread in schools. So those key things we know, why don't we work with them? Because if you keep leaving the students in school, you're like preventing them from their academics, and you kind of, you know the result of what it is, leaving students at home for a very long period of time. So for me, it's like we should start with what we have and wait for other things to come in. If such a device is in existence, we should take advantage of it anyway. Yeah, that's what I can say.
All right, Henry, I'll get back to you and Patrick. But first of all, let me welcome Abraham Awobem. Good afternoon, and thank you for coming on the Hangout.
Good afternoon.
All right, I want to believe you're in Hull City in England, right?
Yes, that's about correct.
All right, then. Oh, thank you. Well, we have Patrick. Patrick Adeni is here in Lagos, Nigeria, just like me, and Henry Yonu is in Stockholm, in Sweden. Right. We're looking at Ebola, and I know you're a medical practitioner. Patrick has just spoken about this device that actually sanitizes the room, not only from Ebola, but from any other communicable disease. But just before that, we're trying to look at the fact that there's this ongoing debate on whether school children should resume school on September 22nd, despite all that is going on. What's your take on that, first of all?
Yeah, well, I apologize a little bit for joining late.
That's good.
Well, I mean, I don't think it's a yes or a no answer, in the sense that Nigeria is a very big country. You're talking about a country that's of 170 million people, occupying a very vast area of land. I can't remember how many square miles, but I know that coast to coast we're about 1,000 miles from one end to the other. So it may not be a case of one shoe size fitting all. So by that I mean, I don't think you necessarily have to prevent all schools from opening all over the country. We can clearly stratify risk in this situation, and adjust. And tailor our plans according to the risk stratification. So, for instance, we do know that so far, and I say we do know because we don't know what we don't know. But what we do know is that you do have the outbreak. Actually, I wouldn't call it an outbreak. I would just say incidents. We do have incidents of infection in Lagos and in Port Harcourt. That's what we know. So you could, for now, defer kids going back to school in those states. But I don't think you need to do that for the whole of the country. And even for, Lagos is a very small state, very densely populated, and Rivers pretty much the same as well. Yeah, so that's what I would say. And then the neighboring states can, so you can, what I'm trying to say is you can have a sort of step ladder resumption date. So the states that are 2-3 states removed from the area of outbreak, they can go back to school. I don't see why not, unless new information comes to light. And then the neighboring states, to the states that have had outbreaks, for now, you may want to defer resumption until we're at least about 4 weeks clear of any new cases. And then they can then go back to school. And then finally, the kids in the very states that are affected, once we're sure there are no new cases in the next couple of months or so, we know that the incubation period max is 3 weeks. So if you take 2 incubation periods, so 3 weeks, 3 weeks, 6 weeks, if there are no new cases within 6 weeks, I would say there's no reason why kids even in the involved states can go back to school. So that would be my own approach to it.
All right, being a medical practitioner, let me come back to Patrick now, because Patrick made mention of this particular device that he knows about. I would like him to shed more light on that, and probably you'd add more to what he said, the possibility of what he said. Patrick, I'll come back to you on the device you spoke about. Can you tell us once again about it?
Well, it's a device. It uses silver nitrate and hydrogen peroxide to sanitize the environment. And once it sanitizes a room, the room can stay sanitized up to a month, depending on the influx of bodies in there. In the United States, like, hospitals are mandatory to have this device in hospitals because it prevents transmittable diseases, whether it's airborne disease or disease where you can transmit, just like Ebola. The device is actually here in Nigeria, but it's like people are not, I don't think people are educated about it. But I think that in the case of where the first Ebola, Patrick Sawyer came to Nigeria, I believe if one of those sanitizers was in the hospital, that the disease might have been contained there. Since you're a medical practitioner, I'm sure you'll be familiar with something in their line.
Okay. So let me come back to you, Abraham. What's your take on that? Have you heard of this before?
Well, I mean, I don't know. I mean, there are lots of products out there that are used for disinfection and sanitization, if you like. I mean, the UK here, from time to time, they do what they call deep cleaning of wards and clinical areas, and there are numerous products. I mean, obviously, hydrogen peroxide, silver nitrate combination are used as disinfectants. I mean, that's great, in the sense of helping to help, spread of infection. But to be honest, in a case like Ebola, which is an evolving disease. I say evolving disease because we don't know everything about this disease yet. For instance, people are not 100% sure whether this is purely transmitted by contact or by droplets or airborne. The last Liberian doctor, American doctor in Liberia, who came down with the disease, was not directly involved in treating people with Ebola. His case is still a bit of an enigma, how he contracted the disease. So it's a disease that's been, we're still studying it in progress. So it will be a case of what, there's a popular store here that's got a logo. They say every little helps. So it's not going to be a one pronged approach, but a many pronged approach, if you like. So yes, I mean, every effort to sanitize, disinfect, yes. But again, you're not just dealing with a in-hospital transmission or in-facility transmission. You're also talking about outdoors as well, So I think bottom line for now is, basic personal hygiene, hand washing. If in the UK here, for instance, found that hand washing is very, very it's a culture really, and even if you can't wash your hand with soap and water, that you have all these alcohol sanitizers everywhere. They're hung on the walls practically everywhere you walk into, schools, shops, everywhere. So those steps are such. But beyond that, for all we know at the moment with Ebola, you also want to minimize contacts as much as possible, particularly with persons who are unwell. What we do know at the moment is that you have to be unwell to transmit the disease. That's what we know. I keep saying what we know because there's a lot we don't know yet. But what we do know at the moment is that you have to be unwell yourself to transmit the disease. So if you've got a family, friend, neighbor, someone who's unwell, don't just, I mean, it's okay to be a good Samaritan, but, you know, be a good Samaritan with wisdom.
All right. I hope we do know some of these things that we don't know at this moment soon, and so that they can help us and just stopping this thing. But Henry, let me come to you now. You know, we've heard about help, you know, coming in from countries that have a higher or a more sophisticated capacity than we do. How would you rate the help that we've seen, that we have received? I mean, from an outsider's perspective, especially maybe from the United States, you know, and so on and so forth.
Actually, I do read some of these things online. I'm not presently there, but I think it's encouraging anyway. But the issue of the viral drug, the one that is still on the testing, still being tested or what, I don't know if, I think there was some issues like it shouldn't be, it's not yet ready for commercial use or something. I don't really know. I won't say much on that, but I think the international bodies are actually looking into this. Even in my school, I studied in KTH, and there was this article I was reading about preventive measures West African countries can take, like mapping, like what the doctor actually said, trying to map out the zones where these things are very, you know, such moves I think are quite good because it's educative, and with respect to the drugs, I don't know how far it has gotten, if it has gotten to Nigeria yet, but I think there are a lot of articles I read that they try to put up remedies or their own thought on the issues, which I think if people get to look at these things to some extent, it could help, you know. So from what I read, I think there are moves from various countries around the world because they are also scared of if it comes over to their own part of the world. So I think they are really encouraging in one way or the other. I'm not on ground, so I can't really say I don't really know what's going on back home.
All right, Abraham, what's your take on that?
Sorry, what was the question? Is that about the medications for Ebola?
Oh no, the general assistance by foreign bodies to Nigeria in trying to curb Ebola.
Well, I mean, it's been good, to be honest. My understanding is a lot of input to the isolation center in Lagos is by the WHO and the MSF, which is great, you know. But remember that in spite of our concerns and all the talk, Nigeria has generally been mercifully relatively spared. If you look at Liberia, look at Syria alone, I mean, it's a different story. You're talking about thousands of cases. It's different to Nigeria where we're counting in single digits or, you know, or maybe just low double digits or figures. So in a lot of ways, I'll say we're lucky. In many ways than one. We're lucky because the index case went to a highbrow hospital. We're lucky because the senior physician of blessed memory who attended to the index case took all the standard precautions any reasonable medical practitioner would have taken anywhere in the world. My kudos to her. You know, it's a different story if it was some person who went through the porous border, fell ill in some local place, was taken to some local general hospital. It would have been a totally different story. So we've been lucky. But yes, I suppose we've had some input from foreign organizations, which has been great, which has been good. Now, in terms of asking for curative measures, the old adage of prevention being better than cure still stands. Okay, there are lots of conditions out there today, you know, in many ways removed from Ebola, that we have cures for, but we still kill many more people than Ebola. So it's not just about having a cure. At the end of the day, prevention is way, way, way better and often cheaper than cure. So I think the emphasis still remains on, excuse me, the emphasis should still remain on preventing transmission. Okay. Now the ZMapp drug that was trialed in the US, I understand they run out. Remember that it didn't help everybody. Even when they gave it to some Liberian doctors, they still died. Okay. Now they're talking about using serum. I know the last American doctor to recover, his serum is now being used to treat the latest American physician victim. Now that's an age-old way of treating infectious disease, dating back, up to 100 years ago. We know that if you use serum of an infected person who's recovered from a viral illness, it provides what we call passive immunity, and it can help to even cure the disease. And that's what the WHO has advised now, that use a serum of people who have recovered to treat people who are ill. Okay, thank God for that. In the sense that it's readily available. We have people who have been cured of the condition in Nigeria. They've recovered, thank God. So you can use their serum to treat new cases. The Japanese are also producing an antiviral, which is still in clinical trial. We don't know how well that's going to work yet. And of course, there are efforts to produce vaccines as well. Now, there are two kinds of vaccines. There are generally vaccines you give to people before they get the disease, rather than to people who have got the disease. Although there are, medications, vaccine type medications you can give to people who already have the disease to help them recover faster. So yeah, those are all the efforts on ground. But bottom line is prevention is still better than cure.
All right, Abraham. So let me come to you, Henry. Now, talking about prevention,
Yeah.
what would you suggest? Abraham has listed quite a number, but it's actually not exhaustive. What would you suggest?
I think awareness is very important. Educating the masses on, if everyone hasn't yet heard about Ebola, but I think there are some remote areas that still needs to be involved, like education, like letting people know what this thing really is, carrying out campaign awareness campaigns, around local districts and villages, and I think informing them on the preventive measures, like the hand glove thing, washing the hands and using disinfectants. I think those ones are basically the primary things they need to know. Like, I think education is the most important thing, because if they're educated, then they actually know what to do. So I think that's the Nigeria. Like I see, there've been so many campaign programs going on, but I think people still need to be aware. I heard of something like a doctor that went in Port Harcourt to treat. I read actually to treat the patient that was infected in Port Harcourt. So I think people still need to be aware of this. Even if a medical practitioner can go to that extent just for financial gain, then there are still problems somewhere. So I think people still need to be educated, which is very important, and know the implications of getting contact with those with Ebola. And knowing the symptoms of this Ebola, I think most people still need to know what is going on. I was talking to a friend that traveled back home the other day, and he was telling me, he had about a whole carton of hand gloves. And I was like, is this what you're going to be using all through? He said, yes, he's going to be using his hand gloves. And I told him, what of sanitizers? He was like, oh my God, I forgot that one. Maybe he will get it when he gets home, but he hopes he doesn't get a fake one. So it's like this, So people have to be educated on what they actually need to do, which is very important for me. I think education tops the list, if you ask me.
All right, Henry. We can see Patrick. Patrick has been coming in and out.
Yeah, I'm having network issue.
Oh yeah, I guess it's one of the problems that we actually have in Nigeria. So just before you came in, Henry was telling us about some preventive measures that he thinks can be put in place, to curb the spread of Ebola. What can you add to what he just said? I mean, Abraham also gave us quite a list of some. Do you have any suggestions on what people should do or what the government
Yeah,
should implement?
the main thing is you keep your hygiene clean. You wash your hands, clean your environment clean, your environment clean up, and stay away from unwell people like Abraham added. So those are the kind of steps that I know that you could take is to really look out for yourself and take care of your own health and being clean.
All right. So just again, Henry made mention of conduct of some of our medical practitioners. Because we heard of
And
a case of a medical practitioner who actually went to treat someone in an isolated place, not a properly isolated, but somewhere the person isolated himself. So we're looking at the conduct of medical practitioners also in curbing this. And what would you advise, or what would you say? What's your thought on that?
I think that because this is such a deadly disease that if any medical practitioner should report any suspected case and not to try to treat somebody in an individual in a private setting, because you never know how you can, like I said, it's still a lot that's unknown about this disease. So it's probably wiser to have a center that deals with this rather than to have an individual doctor. Like, because we've had cases, the one ECOWAS worker that the doctor treated, and now which the ECOWAS worker survived, and the doctor ended up dying. So it has to be, it has to be out. Once you have Ebola, it's not a private matter; it's a nation's matter. So we have to work in together and to try to curb this disease. That's just how it's going to work. That's the only way. And they have to be. I think Nigeria has to have a plan. That the country itself has to have a plan in a way to curb this disease, and not just try to deal with it in random settings.
All right, Patrick. Let me come to you, Abraham. What would you say is responsible? Just like we heard, this man having to treat a patient in a hotel.
Okay.
Yeah.
Yeah, I think, to be honest, I know I've read a lot about this poor chap who treated this patient in a hotel and unfortunately lost his life in the process. I mean, okay, I read a lot of people said he was greed, money, blah, blah. I would say, from a professional point of view, I'll just say it was an error of judgment. Okay? It was an error of judgment. You see, it's a disease, like I said, we don't know much about. This is the first time it's ever been reported in West Africa, ever, since records began. So up until now, no West African practitioner could have claimed to have any experience, even though we're in the tropics. We're in the tropics, like other countries that have had Ebola right from 1975, 76. It's been mainly in East Africa. So it was just an error of judgment, I would say. I mean, in principle, there's nothing wrong in treating a patient. I mean, in the UK here, you can call your own family physician to come see you in your house. You treat people at home. If you feel you're too unwell to go to the hospital or to go to the doctor's office, just ring your GP and somebody will come see you at home. So the concept of treating a patient at home or in a home-like environment in itself, it's actually a standard practice. But I think the questions are, I mean, it's been speculated that he knew this chap had Ebola before he went to see him. Now, I don't know. He's not here to tell his side of the story, whether he actually had reasonable grounds of suspicion that this patient had Ebola before agreeing to treat. I mean, there are circumstantial evidence to suggest that, but we still don't know. We can't be 100% sure. Whatever the case, I think there was some error of judgment there. again, remember that his patient recovered. That may have also given him hope that all was well. It's a different matter if his patient had died and then he failed to report.
Well, Patrick, I guess you're not the only one suffering from network issues. I think Abraham is also a bit down with his network. But then he was talking about a doctor who passed away in Port Harcourt, after treating someone who left Lagos with the virus.
Like we're treating these diseases, right? There are specific guidelines. Like even the U.S. and the CDC passed a law that, like in West African countries, their hospitals have to use sealed mattresses, which is mattresses that prevents the transmission of disease when somebody has laid on it. It's a new product that they have out there, and the U.S. government expressed serious concern with Nigerian government unwilling to unwilling to address this problem, Ebola problem properly. There's a big concern, because they feel like Nigeria has no plan in dealing with this.
Hello, I don't know what happened there. So yeah, so to that, but and I know that certain conditions are reportable in Nigeria. I don't have the list on top of my head right now. I haven't practiced in Nigeria for many years. Hello, can you hear me?
Yeah, go ahead. I think Patrick has a
Yeah, so bottom line is I would just say there is a degree of judgment error there. I'll leave it at that.
All right. So, Henry, do you agree that it is understandable in this profession to have this error in judgment?
Well, I'm not a medical practitioner, but
because I'm just saying, because you as an individual could fall ill and go to the hospital.
Exactly. But I was actually, when I made that point, I was actually looking at it from the point of view from something similar happened before. I think this case was something that happened lately, I think. If we judge from the Soya case with the woman and everything, I think awareness should have been created. I don't know, I'm not a medical practitioner, but if that's the procedure, and I wouldn't judge a dead person either. But that's why I mentioned I laid emphasis on education, people being more educated about this thing and getting to know what symptoms and all those necessary things, Because, so if the medical practitioner says that's how it's okay, that's how it's been done, then I have no other choice but to agree with him. But I think we still need to be educated, in issues like this, so that we don't keep making the same mistakes every now and then. Everyone needs to be educated generally, whether you're a medical practitioner, whether you're an individual, or whatever you are. So I think that education on that awareness still has to be created so that similar occurrence doesn't come up.
All right. Just before I come back to you, Abraham, let's welcome Ben. Ben, good afternoon.
Good evening.
Oh, okay. It's actually evening in Kuala Lumpur, I understand.
Yeah.
All right, awesome. It's actually afternoon here where I am, and I guess it's also afternoon in Sweden and in England. Yeah. But then we're looking at Ebola. We're looking at how we can be curbed, especially how we can contain the spread, from where it is right now. And a lot has been said. Abraham has given us a lot of insight. Ben, Henry also on his own side as a layman has also told us a lot of things. Patrick, who has also been on the Hangout, in and out of the Hangout, because due to network issues, has also made some contributions. What are your thoughts? What can you tell us? What do you think about this case?
I think a lot of awareness have been done on the issue of Ebola, I think so, and a lot of awareness, I can see some of them online. First of all, we have to check our borders very well, because our borders are so open. You have to check every border. Check if you go to the northern part of Nigeria, you see the kind of border we have there. You can walk in with legs. There's no proper check. These are issues that we have to fight with. Our borders have to be properly protected for us to control the ones we have, the few number of Ebola cases that we have recorded. I think if the medical practitioners, if they are able to eliminate those ones, I think we won't have any case of Ebola. But unfortunately, it's like spreading to Port Harcourt, and but we hope that these people are doing their best and they will help us out, because for now, all hands must be on deck to fight this epidemic that has come into Nigeria. And I also have to commend the health officials, the health workers who are fighting this deadly virus. Their life is also on the line. So it's not a question of who is treating, including the doctor is even in trouble. The person who is treating is in trouble. The one who is close to you is in trouble. Everybody's in trouble. So we also have to give them a thumbs up for that, for giving up their life for that. We can see many doctors have passed on, and also we need to this brings a this has to do with the kind of health facilities we have. And in our health sector, a lot need to be done in our health sector. We can see the American doctor that was flew back from Sierra Leone to the US. Of course, he got well after a couple of months. We need to ask ourselves, what has these people done to that doctor? I mean, what are these people done to that medical doctor for him to get well, and of course he was free. The second person has been flown back to the US, and I'm sure the same result will come out. So we just have to do very well to check our borders very well, so that we can be able to curtail the few ones we have. We can be able to curtail and eliminate it, definitely, so that we won't have any kind of case to occur, any kind of occurrence again. That's all I can say for now. But I think also I think also government need to do something about the health, those who are really in the front line in fighting this deadly virus. The medical doctors, we need to cheer them up. We need to support them. And I also want to use the opportunity to commend the Lagos State government for doing their own best, and the Federal Ministry of Health. The Lagos State government have tried so much. They've done so well, and we have to give kudos to them. They've really done so well. We have to commend the Lagos State government, the Commissioner for Health, the medical doctors, and also I'm using this opportunity to pay tribute for the doctor who lost her life in the course of this fight. And we also have to commend her for her little effort. She's done well. She's done so well. That's all I can say.
All right. So talking about borders now. Abraham, I know our borders are kind of very open and not very well manned, so to speak. But our research centers also, I think they have a role to play in this fight against Ebola. What's your thought on that?
Yeah, well, yeah. I mean, like the gentleman said, is correct. The porous border is a big problem. But to be honest, it's a question lots of almost every country on earth are asking themselves right now. I was listening to a radio program last night, a UK radio program, and they were talking about, surprise, surprise, Ebola. And interestingly, somebody specifically mentioned that, well, the Liberian who hopped on the plane and went to Lagos could have headed to London, and exactly the same thing would have, and then that's how the outbreak would have happened in the UK, which is very correct. So the land borders are there, yes, but it's not about the land borders alone. People fly every day. I mean, in the last couple of weeks, I've been to 2 other countries on earth, and there were, 4 cities in different countries, and there were lots of other people, so people hopping in and out, going everywhere, so it's not just the land border alone. So I think every country, and that's why the WHO is now seeing this as a global problem. Although it's presently in 4 countries or 5, in fresh outbreak in Zaire, as we mentioned, Democratic Republic of Congo, but it's a worldwide problem, because there's international travel. That's one. The other thing is this: the reservoir of the disease. People think it's a species of bats, and perhaps primates as well. These animals have no border. They don't need, unfortunately, they don't need passports to cross borders. So you could stop the human being. How about the reservoir of the disease? The monkeys don't have any borders. the bats don't have any borders, and the wild animals don't have any borders. So I think, like I said earlier, this thing it needs a globally coordinated effort, which is what the WHO is putting together. If you go to the WHO website, they already have packages, of how they plan to approach this epidemic. It includes looking at the reservoir, it includes the level of personal prevention, it includes vaccine, it includes advice to each government, what government steps each national government should take to help curb and control the outbreak. So it's a multi-pronged approach. The important thing, I think, is for the Nigerian government to adopt these measures to the letter as much as possible. Again, we've been lucky in Nigeria because, like I said earlier, the index case didn't go to a poor general hospital somewhere, and the professionals who were involved in looking after him were very, they were astute. They took appropriate steps very earlier on, and that's why we're as lucky as we are today. I think while we commend the state government and the federal government for what they've done, they need to go a step further. We have to ask ourselves, had this gentleman gone into an open market or into a very public place, and had he not been a diplomat, an ECOWAS top official, and we had this outbreak, how well would we have fared? Would we have fared this well? I'm not sure. And I'm not trying to not appreciate the effort. If you read the stories of a survivor, I read the story of a gentleman who's the fiancé to the late nurse, and if the account he gave is accurate, then there's a whole lot to be desired. The earlier contributor was talking about the American doctors who survived. I read the account of what treatment they had. They didn't have any magic treatment. It was just what we call supportive care, adequate supportive care. You were able to monitor their electrolytes, you were able to monitor their fluid balance, you were able to monitor the things like how well their blood was clotting, the things that the virus affects, able to give that adequate supportive care to the body, because the human body is fantastic. It will often recover from a lot of assault as long as you support it through the critical period. And that's all they did. They didn't do any magic, Whereas reading the story of what was going on in the Lagos Isolation Center, if the account of that gentleman is truly correct, then it really, really leaves a lot to be desired, and that's it.
All right, so we'll soon be wrapping this conversation now. Henry, let me come to you. What would you like to say just in wrapping up now? Henry.
Sorry, I didn't get you.
Oh, I said we're just closing the conversation. What would you like to say in wrapping up, like your closing remark?
Okay, well, I commend the government for what they are doing. They are really on the situation anyway, but more has to be done. Talking about the issues of like the Lagos state government going to churches to educate them on these things, and I think things like that should be encouraged around the country, and not only churches, other religious institutions as well, so that people are aware, so that we don't spread this thing. So basically, I think state government should copy the way the Lagos state government has been on the situation, and the borders, like the other man mentioned. We should also put efforts to those things and try and see other educate people on the preventive measures. For now, that's what we can stick our hands on, while we hope for better remedy or vaccine that will help us stop this whole thing. Thank you.
All right, I do also hope we find this remedy as soon as we can. Ben, let me come to you. You actually came late, so I'm sorry we were almost wrapping up when you came in. But I believe you can summarize your thoughts in a few minutes.
To fight.
Sorry, Ben. Can you come again?
I said the issue of this Ebola virus is a case that everyone has to put his hand on deck, educate our children, our brothers. It's not a matter of it's not a matter of political or a kind of political fighting, or you can have a whole lot of SSS military on your lobbies or the gates or the entrance. But this of Ebola, you have relative, your relative have friends. They have friends of friends. They go out, they meet people, they come back, and they come to the same house with you. You know, so everybody is at risk, including the president himself. So everybody is at risk. So this is the more reason why more we have to put more effort to see that we fight this deadly virus. It's so deadly, you know. We have to fight it and get rid of it out of our own country, because recently some few guys from Nigeria that came into this country, they were asked some kind of questions at the airport. So this country is also trying their own best to see that they examine anybody coming in from any part of West African country. So that is the kind of measures they are taking, and also they have also alerted their hospitals. I saw in the news they've alerted their hospitals. I mean, any blood sample will be taken. They've established a quarantine center to take care of if they have any, so if they have any kind of case, they can also take care of it. They are at large. Everyone is watching. The medical practitioners, they are all watching. Even when you go to the hospital, they look at you very well. Also, even when they have their own kind of symptom of dengue fever, they also try to check you very well. You know, ask you how long have you been in Malaysia? How long have you been here? When last did you travel? You know, they are also trying. We also have to put up those kind of preventive measures in our own countries so that we can move forward. So Nigeria is a very sweet place to stay, and if this kind of disease is spreading, I think it will be a very bad, it will be a very bad thing for us, and we will not be happy. So we just have to do our best to put all hands on deck to fight this virus, so that Nigeria will be Ebola free.
Ben, I know you're a football lover, right?
Yeah,
I'm sure you heard about the what happened to the Golden Eaglets in the country when they were about to get it.
yeah. I saw the news, but I've not been able to look at the news because of the time difference. Also, I was kind of busy for some time now. I've not even opened channels page on YouTube or whatever. I've not even gone there. But I will take my time to. I just came back now, and I was even rushing because of this program. I've been kind of busy for some few days now.
All right, thank you for coming back, and thank you for joining and making your thoughts, sharing your thoughts, of course, with us. Abraham.
Yep. Well, last words. Well, all I'll just say is that yes, the government are doing good, but they need to do more. We also need to have a proper, if you like, crisis team for Ebola. You know, well coordinated crisis team, well funded as well. You know, we had talks about monies meant for Ebola going to be used to buy vehicles, something like that, but proper setup, you know, to tackle. And of course, the public campaign should continue. Even if we don't have any new index cases, the bats are still there, the monkeys are still there, the wild animals are still there. The effort should be all it should not be should be relentless, if you like. And just to add, you know, just to correct any earlier impression, I wasn't trying to hold brief for the colleague who was treating a patient in a hotel if he knew something was wrong. You know, there are ethics that guide our profession. What I'm just trying to say is that because you know, knowledge is still very limited, and because it's the very first outbreak in West Africa, it's not. It may not. We can't blame him 100% if he made that error of judgment. I think everybody now knows better. I'll be really surprised if any doctor now treated any patient with a fever in a hotel. Thank you very much.
All right, we do understand your concern, of course, for your colleague and for the profession, of course, and of course for your own integrity, because we also have people. It's actually streaming on our YouTube page, and we have people watching. And I would have hoped they sent their comments so that we could read some. I'm using the hashtag curbing Ebola, but then we're just wrapping this conversation up. Ben, you're calling from Kuala Lumpur in Malaysia. Thank you for joining. Henry, you're in Stockholm in Sweden, and Abraham, you are in Hull City in England. Thank you all for joining, and we do hope that all these things we talked about will soon come to an end. For those of you watching on YouTube, we can't take your names, we don't see you, but we know you're watching, and we do appreciate you guys watching, and we hope to see your comments. It doesn't end here. It continues. You can come on Twitter, just tweet at us your thoughts using the hashtag #CarbonEbola, or you can come to our YouTube page. You can come to our Facebook page or our Google Plus page and also make your comments and your voices heard about this issue we've been discussing quite over or almost an hour ago. But then, for now, we'll have to call it quits. You can also follow us on Twitter. It's at Channels Beam, or you can follow me at Victor_MBIDI, and you can also follow at Channels TV_NG. That conversation will continue, of course, online, just like I said earlier. Thank you again, once again, for joining this Hangout, everyone. I am Victor Matthias, and it's a Channels Beam Google Plus Hangout for Channels Television.